Hi, I'm Tracie Foreman with Aging Partners. I'm here today with Sandy Keller, who is a public health nurse with the Lincoln-Lancaster County Health Department. And Sandy is currently project coordinator for the Living Well Expansion Project here in Lincoln. Hi, Sandy. And also joining us today is Peggy Apthorpe, and she is the Health and Fitness Coordinator for Aging Partners, which covers an 8-county area here in Nebraska. Both Sandy and Peggy are here today to share some great information about a Living Well program that is being presented here in our community and in the 8-county area. And we're going to ask them to give us some information, starting with Sandy. Okay. Sandy, I wonder if you can tell us about the Living Well program, what it's all about, and what your involvement is with the program.
Yes, Tracie, the Living Well program is a chronic disease self-management program. It was developed at Stanford University about 20 years ago. And it was designed to help people who have chronic health conditions learn new ways or new strategies to be able to manage their symptoms. So I've been working with the program for about 2.5 years. And that's about the time Peggy and I went into partnership together so that we could develop the program here in Lincoln.
Okay. Now, Peggy, I understand that Aging Partners has taken an active role in presenting the Living Well program to the community. Can you tell us how Aging Partners got involved with the program?
Well, initially, I participated in a workshop. This was in 2009, a workshop offered at the Downtown Senior Center. And I realized that this program really fit into our mission, which is to empower older adults and caregivers to manage and improve their health. In the fall of 2009, about 5 of us from Aging Partners and several other people from around the state participated in a leader training. So we started offering the workshop in the community at various locations in 2010. We received a grant from the State Department of Health in July of 2010, which really enabled us to expand and develop the program in the 8-county area. Yeah.
Great. Sandy, is the Living Well program offered only here in Lincoln?
No, the program is offered in different settings in Nebraska, across the United States, and in other countries.
So, Peggy, can you tell us what role Aging Partners played in developing the program in the 8-county area?
Well, we did have leaders from Lincoln who would go and work with other people in the community to plan, implement, and promote the Living Well workshops. In some cases, we would give them the packets that the participants needed. We would take registrations. We also compiled all the information that was necessary to go to the state for the grant.
Okay. And so who were your partners in this
well, you know,
community involvement?
Partnerships have always been very important to us, and we had a number of partners. Locally, we worked with Southeast Community College, Williamsburg Hy-Vee, the Northeast YMCA. We worked with a number of senior centers, including the Lead Senior Center in Seward, Geneva Senior Center, the York Senior Center, David City. We also worked with a number of residential facilities, including Burke Plaza, Mahoney Manor, Clark Jerry, Northgate Garden Estates. I can't think of any others right now, but our partners have been really crucial to acting as host sites, helping to promote the program.
Sandy, is there a certain type of person that would benefit from taking the Living Well program?
Anybody who has a chronic condition, such as diabetes, arthritis, high blood pressure, people who have anxiety, depression, which is just about anybody today, or those who are dealing with like chronic pain would definitely benefit.
Okay, so a cold or the flu wouldn't fall into the category as a chronic condition?
No, because the cold or flu is of short duration. It's something that you can expect to be over with in about 2 weeks. But a chronic is one that would probably last a lifetime.
Okay, it's good to understand that. So the program is set up in a 6-week format, correct? Yes. What's expected of participants in terms of time commitment or just commitment in general?
Right. Participants would meet 1 time a week for 6 weeks, and for about 2 to 2.5 hours. We have a lot that we do, so that's about the time that they would expect to be there.
Okay. Is this 6 weeks of lectures, or do the participants get involved in any way?
They get very involved, don't they, Peggy? It's, even though the facilitators like yourselves and me facilitate, we're called co-leaders, there are 2 of us. Even though we deliver it in a lecture style format, the participants are very interactive, aren't
There's
they?
a lot of brainstorming, problem solving. They develop action plans every week and report on those.
So, well, Peggy, you've been involved in the Living Well program, you said, since 2009. What would you say the greatest rewards have been for you being involved with the program?
Well, of course, seeing how it benefits the participants has been very rewarding. And it's also fun to see how they kind of form a group at the end, and they keep in contact with one another and support one another. We've also really enjoyed being part of a national movement to improve health and contain healthcare costs, and working with all of our partners locally and throughout the state has been really very rewarding as well.
Now, have you come across any challenges along the way?
I think that the main challenge has been we would like to have more resources to plan, implement, and promote the program and raise community awareness. That's why we're so excited about the expansion project that Sandy's able to do here in Lancaster County, where she'll be working more with the healthcare community, making them more aware of the program so they can refer more people to it.
Great. Yeah. Sandy, it sounds like self-management is the foundation of the program. Can you talk a little bit about that?
It definitely is. If you think about, I'll just give an example. If you think about a person who has like chronic back pain, they're probably at the doctor more often than they want to be, spending more money than they want to spend, taking more medications than they want to take. If that person were able to learn new strategies to be able to cope with those symptoms, he might be able to visit the doctor less frequently, which would be a cost savings for him and for the healthcare system in general.
What about a person who is a caregiver to someone with a chronic condition? Could they benefit from the Living Well program?
Oh yes, for sure. I think that caregivers probably have a chronic condition going on too, because many of us do.
And they forget to take care of themselves, I think is one of the main things.
They do.
That's so true.
That's true.
So true. Well, now either of you could probably answer this question, but is there a fee for the program?
Most workshops are free, but Peggy knows.
And for the first few years, we were able to offer the workshops for free because of the grant from the State Health Department. Right now, we have a suggested contribution of $22 for the entire workshop. And if people, we never want inability to pay to keep anyone from attending the workshop, so it is a suggested contribution of $22.
And that's really a very reasonable fee for 6 weeks. The Living Well program sounds like an excellent source of information for anyone living with a chronic condition or anyone who's caring for someone with a chronic condition. Sandy, are there any future plans for the Living Well program here in Lincoln?
Yes, the current project that I'm coordinating is the Living Well expansion project, and with this project we are hoping to establish a physician referral system here in Lincoln whereby a physician or any healthcare provider could refer to one of several ongoing workshops in the city. So in order for that to work, we have to have people who are willing to host the workshops, like Peggy was saying earlier. And we do have, at this time, we have the Williamsburg Hy-Vee and the Northeast YMCA, the health department, and Southeast Community College is willing to host them. So they would be able to refer then to one that's ongoing.
We also hope to offer workshops at the VA hospital.
Excellent.
Yeah.
Excellent. Well, Peggy, what about future plans for the 8-county area?
Well, for sure we want to maintain what we're currently doing and expand upon that as our current resources allow. But we really want to work on developing third-party reimbursement. This would include Medicare, Medicaid, private insurance, because the program really does save money. I received a report last week that indicated for every person who participates saves $740 per year in emergency room and hospital costs. And if 10% of all the people with a chronic condition participated in this, it would save $4.2 billion a year.
Billion dollars,
yeah.
That's
so
amazing.
hopefully we're going to get some third-party reimbursements, which would really enable us to expand. Yeah.
Excellent. For those watching this show that are interested in signing up for the class, what types of information will they get when they do come?
Well, despite all the information they'll get from the workshop sessions, there is a book called Living a Healthy Life with Chronic Conditions that is really just filled with all kinds of good information about exercise, healthy eating, communication with the healthcare professionals, and so forth. And they also get a relaxation CD called A Time for Healing. And it's been really fun to see how many people begin using this. A lot of people who maybe have never practiced relaxation or consciously practiced it really like this tape and use it to learn how to relax, actually.
And as a program facilitator myself, I can say that the Living a Healthy Life with Chronic Conditions book is a very simple read, and the CD is very well received. So, well, that brings us to who do they call to get signed up?
They can call either me or Peggy at Aging Partners, and that information will be on the screen.
Well, thank you, Peggy and Sandy, for joining us today. And we appreciate all the great information you gave us about the Living Well program. Until the next time, remember, live well, age strong. Thank you. Most of her adult life, Jane didn't worry too much about her health. Then, at 67, she was diagnosed with diabetes and high blood pressure. She tried to follow her doctor's advice to take her medications, exercise, and eat better, but often she was tired and even a little depressed. Then a friend told Jane about the Living Well program. Workshops comprised of 6 weekly sessions held at convenient locations throughout Lincoln. The workshops are designed to help people with ongoing health conditions such as arthritis, diabetes, and high blood pressure, among others, and learn practical skills for managing their chronic health problems. For more information or to register for a workshop, call Sandy Keller at 402-441-4605 or email at skeller@lincoln.ne.gov.